Hello friends, welcome back to Lowmedics. This lecture is on thyroid gland anatomy and physiology. What is thyroid gland? Thyroid gland is an endocrine gland in front and sides of trachea at the lower part of neck. It produces thyroid hormone and calcitonin. They regulate the metabolic activity and calcium metabolism. Now the anatomy of thyroid gland. It is a butterfly-shaped endocrine gland. In normal adult, the weight of thyroid gland is 50 to 20 gram. It is larger in female than male. In female, its size is increased during pregnancy and menstruation. It is a highly vascular area. Next, location of thyroid gland. In neck, it is wrapped around the trachea anteriorly and it is located between cricoid cartilage to suprasternal notch and below the thyroid cartilage, which means Adam's apple. You can feel your thyroid gland below your Adam's apple during swallowing. Embryology. It is the first endocrine gland formed in the embryo at 24th day, which means 3rd week of gestation. It formed from foramen cecum and it continued as thyroglossal duct and it formed the thyroid gland. Now the covering of thyroid gland, inner capsule and outer false capsule. The outer false capsule attached to hyoid bone and also attached to cricoid cartilage by beryl ligament. Because of its attachment to thyroid cartilage, hyoid bone and thyroid gland, it is moved during swallowing. During removal of thyroid gland, this thyroid gland removed along with choke capsule to avoid hemorrhage. Now the parts of thyroid gland, it has two lateral lobes. These two lateral lobes are connected by isthmus. The main two lateral lobes are right lobe and left lobe. Occasionally a pyramidal lobe which is extended from upper part of isthmus. It is also called as Lalauchi pyramid and it is the remnant of thyroglossal duct. Now parathyroid gland. It is present posteriorly and it produces the calcitonin hormone. Parathyroid gland which produces calcitonin hormone. Thyroid gland which produces triiodothyronin and thyroxine, which means T4. Now the microscopic structure of thyroid gland. The thyroid gland consists of 3 millions of thyroid follicle. The thyroid follicle is also called as acini. It is a structural and functional unit of thyroid gland. This thyroid follicle lined by single layer of columnar epithelium during moderate activity. During more activity, the cuboidal cells are converted into columnar cells and these follicles are large in size and it produces large amount of colloids. In inactive state, the cells are converted into flattened epithelium and the follicles are smaller in size and it produces less amount of colloids. These cells are involved in the synthesis of protein called thyroglobulin. When we eat the iodine-rich food, the iodine is taken from food into the blood and it is taken into the lumen of follicle. Already thyroglobulin is present here, right? So the thyroglobulin is converted into colloid. Colloid is the clear viscous material. Certain enzymes act on the colloid. It produces thyroxine hormone, which means T3 and T4. T3 means triiodothyronin. T4 means tetraiodothyronin. In microscopic structure, parafollicular cells are also present in the thyroid gland. These parafollicular cells present between the base of follicular cells and basement membrane. It secretes thyrocalcitonin. Thyrocalcitonin, this hormone regulates the calcium by depositing it in the bone. Now the thyroid hormones. Thyroid gland produces the T3, which means triiodothyronin, T4, which means tetraiodothyronin. They are regulate the metabolic activity. And parathyroid gland, which produces the calcitonin. It regulates the calcium, which means homeostasis. Now the mechanism of thyroid hormone production and release from the thyroid gland. First, the hypothalamus send the hormone, which means thyroid releasing hormone. This hormone acts on the pituitary gland and this pituitary gland produces the thyroid stimulating hormone. This hormone acts on the thyroid gland and this thyroid gland produces the T3 and T4. If our body needs more amount of thyroid, it sends the signal to hypothalamus and pituitary gland. So these glands produce the hormone and it acts on the thyroid gland. It produces more amount of T3 and T4. If our body needs less amount of thyroid hormone, then it sends the negative signal to hypothalamus and pituitary. So these glands stop the production of these hormones. So the thyroid gland stop the production of thyroid hormones. If our blood has high amount of thyroid hormone, it sends a negative signal to pituitary and hypothalamus. So low amount of TSH and TRH is present. If our blood has low level of thyroid hormone, the pituitary and hypothalamus send the TSH and TRH. Now the function of thyroid hormone. It stimulates the appetite and digestion. It breaks down nutrients and absorption of food materials. That's why it helps to the mechanism of our body. And this thyroid hormone increases our heart rate and respiratory rate. This thyroid hormone produces more body heat. That's why our thyroid level is usually raised in winter to keep our body warm. It regulates the rate of growth and maturity of nervous system. Now the blood supply of thyroid gland. Superior thyroid artery. It is a branch of external carotid artery. Inferior thyroid, which is a branch of thyrocervical trunk. It is a branch of subclavian artery. The thyroid gland is also supplied by accessory arteries. They are tracheal artery and esophageal artery. In 3% of people, thyroid imma artery is also supplied to the thyroid gland. Now the venous drainage. The pair of superior thyroid vein and middle thyroid vein. These are drain the deoxygenated blood into internal jugular vein. It is drained into brachiocephalic vein and inferior thyroid vein, which is drain the deoxygenated blood from thyroid gland into the brachiocephalic vein directly. These deoxygenated bloods are passed into superior vena cava. Now the nerve supply of thyroid gland. Sympathetic innervation and parasympathetic innervation. First, sympathetic. The sympathetic fibers arises from cervical ganglia that does not control the secretion of thyroid hormone. It has vasomotor fibers, so it control and constrict the blood vessel. Parasympathetic fibers, which arises from vagus nerve, it branches superior laryngeal nerve. These are superior laryngeal nerve. They are partly supplied to thyroid gland and mainly supplied to the laryngeal muscle. The right vagus nerve continued and give the right recurrent laryngeal nerve, left vagus nerve which give the left recurrent laryngeal nerve, which is wrapped around the aortic arch and give the nerve supply to thyroid gland. And this nerve is important for speech. It may be damaged during thyroidectomy. So the voice changes occur after thyroidectomy due to the damage of this nerve. Now the lymphatic drainage of thyroid gland. These are superior deep cervical lymph node. These are inferior deep cervical lymph node. This is submental and this is submandibular lymph node. This is prelaryngeal lymph node. This one is pretracheal lymph node and this one is paratracheal lymph node. Now the applied aspect. Goiter, it is the enlargement of thyroid gland. Hypothyroidism in infants is also called as cretinism. Hypothyroidism in adult is also called as myxedema. Hypothyroidism, it is due to thyrotoxicosis. Hashimoto thyroiditis, it is the autoimmune disease which is caused due to the production of antibody against thyroglobulin. Tubercle of Zucker candle. This is a lateral projection from the lateral lobes of thyroid gland. It is a constant landmark for finding recurrent laryngeal nerve during thyroid surgery. Thanks for watching.